My name is Jesse Fann, and I'm a psychiatrist here at Fred Hutch Cancer Center, and I'm the medical director for Psychosocial Oncology here at Fred Hutch. Psychosocial oncology is a cancer specialty that addresses the full array of psychosocial issues that include psychological, emotional, behavioral, and social issues that come up during an individual's cancer treatment, and also those issues that come up for their family members. And as everyone knows, diagnosis of cancer and its treatment leads to a lot of stress, and the field of psychosocial oncology is really aimed at helping people navigate that distress to the best of their abilities. Going through a cancer diagnosis and its treatment is extremely stressful for families and patients. And sometimes those stressors can lead to significant symptoms such as insomnia, anxiety, intense fear, even sadness and depression, and sometimes hopelessness. Can also lead to things like cognitive issues like memory and concentration problems. And these problems can really affect a person's ability to get through their daily lives and even get through their cancer treatment. Really the goal of the psychiatry and psychology service here is to help people get back to doing the things that they want to do and to help them get through their treatment as smoothly as possible by addressing these issues. What sets us apart from other cancer centers is that we bring together really diverse and highly skilled multidisciplinary team to provide state-of-the-art psychosocial care that's fully integrated into a person's cancer treatment. And our integrated psychosocial oncology program brings together a multidisciplinary team of psychiatrists, psychologists, clinical social workers, advanced practice providers, nurses, and patient navigators that are able to get to know each patient very well and to tailor psychosocial care for each specific patient's psychosocial needs, and to address the full array of needs that come up during the course of their cancer treatment. So our psychosocial providers at Fred Hutch are specially trained and dedicated to the care of patients and family members dealing with cancer. And they are also trained in evidence-based or proven strategies that can address the many psychosocial issues that arise. For example, they're trained in a number of different counseling approaches and also the use of medications if needed to address the emotional and psychological, behavioral, cognitive issues that come up. And by doing that, they're able to help people, again, get back to doing the things that they want to do. We also, very importantly, work very closely with every individual to really understand their values and understand the preferences, the treatment preferences that they might have, to really come up with a plan that's coordinated with exactly what they're wanting in their treatment. And also we work very closely with the medical teams to make sure that we coordinate with them to best help each person get through their cancer treatment. Because of our training in what we call psycho-oncology, we're much more familiar with the cancer treatments that people are receiving. There's always new ones coming out, and because we're really dedicated and focused on this population, we keep up with those new treatments and work closely with the medical teams to make sure that whatever we recommend works hand in hand with what a person's getting through their medical team. So, of course, the goal is to identify issues that come up as soon as possible before they become big issues. For that reason, we do use some screening instruments or surveys, similar to, when you go to your doctor's office, you might get a blood pressure check and a temperature check. We want to know, how things are going for you, not just from a physical standpoint, but from just an emotional and psychological standpoint too. We really encourage people to ask for help whenever they feel like they may need it, and not to wait till something really becomes a crisis. So we encourage people to ask their medical team for a referral to our services, and that could mean a direct referral to a specific type of provider, like a psychiatrist or psychologist, or typically it's an initial referral to one of our clinical social workers that's really embedded into their specific clinic for an initial assessment, and that can be done typically very quickly. And we provide this care either on site, in person, if a person prefers that, or we can provide our services through telehealth, which is very convenient for many patients.